Yes. So as far as we know, weight loss medicines are safe. We have to, however, appreciate that the more recent weight loss medicines, the so-called GLP-1RA medicines, such as semaglutide, which is the generic name, but more commonly known as Ozempic or Wegovy, Mounjaro, for example, these new generation of weight loss drugs are fairly new in terms, probably 4 or 5 years old, some of them more recent. And we do not know the long-term consequences of this type of treatment if taken for, should we say, years or decades. So that's the honest answer. We do not know the long-term side effects and consequences. So traditionally, weight loss medicines have been working in different ways. There was initially the orlistat medicine, otherwise known as Zanical or Ali, which stopped the action of the enzyme lipase in the intestinal tract, stopping the absorption of fat. Other weight loss drugs are working through reduction in appetite. And that's in fact what the new generation of weight loss drugs called GLP-1 RAs, that's how they work. So they predominantly work on the brain to reduce appetite, but they also have other direct effects, for example, on the stomach to reduce gastric emptying. And this is how these drugs are working. And there are other drugs that are currently being evaluated as well that promote satiety or fullness. So with the new generation of GLP-1 receptor agonists, such as Wegovy, Ozempic, Mounjaro, typically most patients will get an element of nausea, constipation, or diarrhea can also occur. Headaches, fatigue are also felt by some people. The fact is that for most people, these tend to be mild, and the longer you take the treatment, there tends to be adaptation, so these side effects get less. But for some people, they're so strong that they have to stop the medication entirely. More serious side effects can include pancreatitis or inflammation of the pancreas, and one other complication that's been seen never in humans, but in initial laboratory studies when these drugs were first tried out on the animal models, was a higher incidence of thyroid cancer. So if anybody has a personal or family history of thyroid cancer, we do not prescribe these drugs. Yes, you can take these medications if you have previous gastrointestinal conditions or previous surgery. It shouldn't really be an issue. But again, I would stress you should speak to your physician or your surgeon to get a proper evaluation. So the GLP-1 receptor agonists, such as semaglutide, otherwise known as Ozempic or Wegovy, and also the new generation Mounjaro, these are certainly better than what we've traditionally seen in the field of weight loss medicines. These drugs typically offer around 10% weight loss, up to even 12% weight loss in clinical trials. So by far, they're doing better than previous drugs, such as orlistat, where we were getting 3% weight loss, and liraglutide or saxenda, where we were getting 5% weight loss. So that's really good news. I think there's generally, a good number of people who will benefit from these drugs, but we should also keep in mind that 30% of people who try these drugs don't benefit, don't see any weight loss. A lot of folks will get side effects. And the other thing to remember is no one knows what the long-term consequences are of taking these drugs long-term, because nobody's had it for more than, I would say, 3, 4, 5 years at the moment. And ultimately, once you begin treatment with these medicines, as soon as you stop the treatment, you will regain the weight. So you have to go in thinking that this is going to be a long-term treatment.